All right, welcome back. Good to see you. So we want to talk about how to quickly identify what we'd call a derangement in the lower back. So that's typically a disc injury, and we're lucky to have Jake here who actually did that to himself while doing some deadlifting in the past. Now we have fixed it in the past, and he's gotten back to doing all of his normal routines. Yep. But then just recently, a change in his workout routine. Did it again. So it's typically identified by a couple of key variables or symptoms. So there's typically a change in motion, and for Jake, when he does a lot of flexion or bending type things, deadlifts, burpees, maybe some jumps, bent over stuff, rowing. There's a mechanical loss of motion in the sense of he actually gets stuck and has a hard time coming up. He also will get what's called a lateral shift, and he will actually feel like he's shifted to one side. And for you, it's the right side, so your hips will go to that side. They typically open up to the side of the pain. His pain levels are not bad. No. I mean, the pain is low. Yeah, 1, 2. So 1, 2. Like this. He doesn't have a lot of pain. He doesn't have leg symptoms. Nope. There are sometimes you may have leg symptoms associated with this. Sometimes the pain levels could be higher, but this is the variability that's involved in this. So he'll get this obstruction to movement. Can't stand up straight, gets an acute deformity, right, deranged, and then we can easily change it and easily fix it. But let's just show him how to derange you. Okay. Go ahead and come back and look. Yep. So there's his baseline flexion. No pain with that, and that's the extension right there as far as you can. Okay, as he keeps going now, he's going to use a loaded flexion and sitting. So he's going to flex. He's going to keep going and put the lower lumbar spine with repeated motions. He's going to push on the front side of that disc because we know that there's a little bit of a weak spot now for him where he's had that injury in the past. So he's going to flex, he's going to pull and really flex hard. And essentially don't do this at home. Please don't do this at home. This is for, but he's going to re-derange himself to where now he's stuck. He's got he's hard. And see, so that's very common. When he gets out of the chair, he has a hard time rising out of the chair and he's stiff. And you can see he can't even get all the way like straight this way and standing anymore. So then recheck flexion. And he can't go nearly as far as he did the first time. Yep. And then go backwards. And he's very stuck. So major loss of extension. It does not take more than a few reps to do that. So for him, what we have to do is we have to get into extension. So we unload him. Down, yep, and the first one's going to be a little bit tough, pain through here, but then as he keeps relaxed, he presses up. So now we're going to get a set of extensions in, and we've already tested this. So again, this is not something that I'm saying you should try right away at home because we've assessed this, tested this. We know what makes him worse. We know what makes him better. It may be this way for you, but it may not be this direction for you. Yep, keep going. So he's getting all the way to end range. Elbows are locked, chest is high. He's breathed out. Is that even a correct way to say that? Yeah, he's exhaled so that this is very relaxed and passive. His stomach and hips are falling. Okay, now when he stands, he looks straighter in standing. He doesn't have the shift. And then go back to your baselines. He can bend and he can extend. Yeah, so it typically, now this is a bit of a, the bell-shaped curve. This case kind of lands toward the extreme where we can change it very quickly within just a few repetitions. Not everyone will be able to change this that quick, and not everyone will have the same symptom. Where he has very low or limited pain. It's more of a mechanical problem. He just feels stuck and just can't move with too much bending. Some will have, they'll have good motion, but a lot of pain. And some will be,